We know there's at least 250 plus infected children and adults is probably an underestimate. It could be considerably higher because some of the affected individuals haven't sought medical attention. Others are still in the process of being diagnosed. The numbers keep going up every Tuesday and Friday when the Texas Health Department reports it out. The reason it's happening is because we have a large unvaccinated population in West Texas. That this part of Texas had the lowest COVID, some among the lowest COVID vaccination rates, and unfortunately very high death rates in during the pandemic. So the lowest COVID vaccination rates were in some of these same counties, and it's spilling over to childhood immunizations. And so what could be done is we've got to, one, create opportunities for especially parents of unvaccinated kids in this area to start going to vaccination clinics that are being set up, but persuade them to go through with it. I mean, even if they're exposed to measles virus, if they're vaccinated within 72 hours of exposure, the vaccine will still have a protective effect. I like the comparison to having a hurricane over warm water. As long as there's warm Caribbean water around, the hurricane will continue to accelerate. In this case, the warm water is the large unvaccinated population in West Texas. The vaccine's one of the safest, most effective vaccines we have. Single dose, more than 90% protective. Two doses is 97% protective. We typically will vaccinate children around 12 to 15 months of age, and then give them a second dose around school entry, 4 to 6 years of age, and if a high percentage of children in the community are vaccinated, say over 90-95%, that in itself will create a herd immunity phenomenon that'll stop transmission. And the numbers will continue to climb as long as there's large numbers of unvaccinated individuals. This virus is one of the most transmissible viruses we know about because it takes a low inoculum of virus to set up infection, and the virus can linger in the atmosphere even after a person has left the room. So somebody with shedding measles virus can go in someplace, shed virus in the atmosphere inside a room, let's say, and then that individual can leave, and an unvaccinated child or adult walks in there, they could become infected very easily. The three C's, it's cough, what's called coryza, which is upper respiratory cold symptoms, runny nose, and a conjunctivitis. And those three C's are then followed by the virus getting entrance into the bloodstream and causing a characteristic rash that starts at the hairline and then spreads downward. And then, unfortunately, around 20% of kids require hospitalization if they're unvaccinated, and a high percentage have measles pneumonia, what's called the giant cell pneumonia, and encephalitis. And also, the virus gets into your immune cells and damages your memory,